Hello, my name is Dr. Amanda Gilbert.
And I'm Dr. Lewis Gilbert.
And we're here to discuss a very important topic, colon cancer awareness, on our Marriage Ministry Medicine platform. We definitely want to send our heartfelt condolences to the family and friends of Chadwick Boseman, a phenomenal actor and philanthropist and fellow Howard University Bison, who lost his battle with colon cancer. And it's definitely important that we take this time, that as a community we really understand more about colon cancer and how we can protect ourselves.
In the United States, colon cancer is the third leading cause of cancer-related deaths among men and women, and studies have even shown that for ages less than 55, colon cancer has increased by 1% from the year 2008 all the way to the year 2017.
And what we've seen within the African American community is that we are more disproportionately affected by colorectal cancer, colon cancer. What we're seeing is that African Americans are actually 40% higher chance of actually dying from colon cancer and a 20% higher risk of being diagnosed with colon cancer. Strangely enough, although this disease is preventable, 1 out of 3 Americans will not get screened at the appropriate time for colon cancer. But we do know that with earlier detection, the survival rate is higher.
So what are some risk factors for colon cancer? So studies show that 90% of all colon cancer cases occur in individuals above the age of 50. So age is a risk factor. In addition to age, if you have a family history of colon cancer, or if you have a personal history of colon polyps, that puts you at increased risk for colon cancer. In addition to that, having a history of inflammatory bowel disease like Crohn's disease puts you at increased risk. And also, if you have any genetic syndromes that are associated with the colon, they can also put you at increased risk for colon cancer.
In addition to those risk factors, there are also some lifestyle risk factors that are associated with higher chances of having colon cancer. Those include a lifestyle that's low in diet and exercise, low fiber, those who are smokers, alcohol use. All of those things tend to raise the risk of having colon cancer diagnosis.
So when is a good time to get screened for colon cancer? The United States Preventive Services Task Force, they recommend that you get screened from the ages of 50 to 75.
And then the American Cancer Association, because of those cases of seeing more people, younger cases, they do recommend starting screening at 45. Now, our goal today is to allow you to have all the information to have this conversation with your primary care doctor. Now, usually most insurances are going to cover 50 and above, but definitely have that conversation. If you're just doing regular screening, no symptoms, have that conversation with your primary care doctor and also your insurance company. Now that we know the appropriate ages for you to get screened, the next step is to identify which testing is going to be best for you. So there are several different categories. One will be the stool categories. Now, in terms of the most effective, colonoscopy is going to be your first, but we'll start with the stool samples. One option would be the FIT testing, which basically is looking for antibodies in your stool to colon cancer. And for that one, if it's normal, it's recommended to repeat it once every year. Again, that's not the most accurate way of doing your screening. Above that would be tests like Cologuard, where you're sent a little sample to your home and you give a full stool sample, you send it to the lab. And if it's abnormal, meaning that they found any blood in your stool or any DNA related to colon cancer, it is recommended that you go ahead and go for a colonoscopy. If it's normal, then every 3 years you would repeat that test.
The next test that is available is the flexible sigmoidoscopy. We call it FlexSig for short. This test looks at the lower third of your colon as well as your rectum to see if you have any colon polyps. If you have any polyps, they can be removed. If this test is normal, it's recommended that you have it repeated every 5 years. The best test is the colonoscopy because it looks at all of your colon And if the doctor sees any colon polyps or any signs that look suspicious, we can take sample and we can send it to the lab to see if it's cancerous. The good thing about the colonoscopy, if you have that completed and it's normal, then you repeat it in 10 years. But what are some signs and symptoms that will prompt you to get an earlier screening? So if you have any blood in your stool or if you're having any bleeding from your rectum, you want to bring that to your primary care doctor's attention so they can get you set up for earlier screening. In addition to that, if you're having abdominal pain and cramps that just won't go away, or if you're losing weight and it's unintentional weight loss, these are signs and symptoms that you want to bring to your doctor's attention so they can get you set up for a colon cancer screening test earlier than the age of 50.
So thanks so much for tuning in, and we do hope that you left this video with some helpful information. So key takeaways that we want you to share too with your family and friends. 1, we want you to know your family history, know your risk factors that can increase your risk for colon cancer. 2, make sure you look at your poop. There's no shame in that. Make sure that you're not having any blood in your stool, anything like that. And thirdly, don't allow kind of the fear, the nervousness of going through these tests, like the best test, the colonoscopy, to prevent you from knowing exactly what's going on down there. Like we said, we know that earlier detection possibly can lead to higher survival rates. And that's what we want, healthy communities, healthy families. So if you found this video helpful, I need you to do 2 things for me. Talk to your primary care doctor if you're due for your screenings. And secondly, definitely go ahead and share this video with your family and friends.
Be blessed, be encouraged. See you next time.
Bye-bye.